invocation and then the pledge by Ms. Blackman.
Let's pray. Dear Heavenly Father, we come before you so humbly this evening, Lord, and the thoughts that come to my mind, Lord, as we come before you are just those to be still, Lord, reminding us to be still in your presence, to have our thoughts with those in need. Lord, we think about your teachings of the fruit of the Spirit, and you share with us that the greatest of those is love, Father, as we think about how we are encouraging others and loving our neighbors and loving those in our community, loving those that are hurting in so many, many, many ways, Father. The lyrics of the songs this morning on my way to work were those that said, your mercies are new every day. And they certainly are, Lord. We just pray that you'll be with us, our community, our employees, our families, Lord, that you will just wrap your loving arms around us and give us grace and mercy. In Jesus' name we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ms. Blackman. Good afternoon. Thank you all for being here. I call this meeting to order. Roll call members. We have Mr. Brantley, Ms. Compton-Twist, Ms. Howerton, Mr. Durrance, Superintendent Dr. Brenda Longshore, Mr. John McClure, our board attorney, and Ms. Marlene Welborn, board secretary. Moving on, do we have any school board committee reports? No? Okay. Any petitions? No? Okay. Superintendent's report. I know we have something there.
Okay, we have just a few things for tonight. I'd asked Patrick Hickey from the Health Department to speak with us. I don't see Pat. Oh, okay,
Tiffany's here.
great. Do you want to come up and share a little update from our community? Thank you for being here tonight.
Hi, good evening. Can you hear me okay? I'm
Yes.
Tiffany Collins. I'm the interim administrator with the Florida Department of Health here in Highlands County. And Dr. Longshore asked that I come give a update on our COVID operations and what we're doing against the fight against our pandemic. The best way to prevent severe illness and hospitalization is to get vaccinated. Florida and Highlands County has many sites providing the COVID-19 vaccine for eligible providers. It is safe and effective against all variants, including the Delta variant, which we're finding is about 60% more contagious. Breakthroughs remain a small percentage of our overall population. Of the 320 breakthroughs that Highlands County has seen, it makes up about 2% of our population. About 50% of those breakthroughs have happened just in the last 2 months alone. The total variance, including the Delta variant, is less than 1% of all our cases. With the vast majority of hospitalization admissions for COVID are individuals who are unvaccinated or who are not fully vaccinated. In vaccines in the county last week, we had 810 individuals who were vaccinated, and the prior week it was 1,018. So there's been over 56,000 individuals vaccinated in Highlands County, and that's about 60% of the 12 and up population. If you're concerned about a potential exposure or your health, you can get tested at a testing site near you. Last week in Highlands County, there was 1,072 cases. That's average about 150 cases a day, and that's a 27% positivity rate, so higher still than our total positivity rate of about 25% for the total pandemic. The prior week, it was 1,153. Total overall cases, 14,129 in Highlands County. In the last 2 months alone, our cases have been 37% of the total cases throughout the whole pandemic. About 30% of these recent cases are in school-aged kids, so age 5 to 19 is the breakdown we can give with our dashboard, and we continue to work with our local schools and our school boards in surveillance and case contact tracing to ensure that we aren't doing a sweeping exclusion and to keep that down. So Dr. Longshore had asked that I provide some data. We provided some data by schools. That was for the pandemic total. Right now the state is working on a dashboard for the schools to kind of be able to drill down on that a little bit more. In July, there was 140 students that had COVID, 35 staff. In August, there was 342 students, 18 staff. And in September, 255, so far in September, 255 students and 1 staff member that have been positive for COVID.
And that's in September?
So far this
Okay.
September, so far, yes. We've had 3 days in the last week. Individually, were record-breaking cases for the most that have ever dropped in Highlands County, over 250 cases a day. So we do continue to believe that our cases will spike and decrease over the next few months, with some spikes being after the holidays when we tend to gather more and have family and friends from out of state come in. So 30% of the cases in school-age kids, and the breakthroughs make about 5% of our total cases just in the last 2 months. 13% in that same time frame of hospitalizations have happened in the last 2 months, and 12% of our 435 deaths in the last 2 months. We expect the cases again to continue to spike, and if you feel you should test positive for COVID, early treatment is the key prevention strategy from becoming severely ill. So if you're at least 12 years old and high risk, you are eligible for the monoclonal antibody treatment, and this gives you temporary immunity to decrease your odds of severe illness, hospitalization, and even death. Early treatment has been proven effective at saving lives, and I would add that it's not should not be considered in lieu of vaccination, but actually in tandem with vaccinations. So not to think because you have the treatment that might be available to you to help make that decision of whether or not you get vaccinated. We still encourage you to get vaccinated. So our continuing messaging for mitigation strategies, first and foremost, get vaccinated. They are safe. They are effective at saving lives against COVID. If you are sick, stay home. Just pause. If you're sick, stay home. If you stay away from people who are sick, and continue to practice social distancing measures, wear your mask when you're in public or in your crowded places or indoors, even if you've been vaccinated. And then continue the good hygiene, hand sanitizing, the cleaning and disinfecting of frequently touched areas as additional mitigation strategies in our fight against COVID. For more information on the vaccines, the testing, the treatment sites, locations, appointments, and how you make those, referring all of our forward-facing information, including the statistics that I provided today that are directly from the CDC, to floridahealthcovid19.gov, and that's spelled out, floridahealthcovid19.gov. Your local health department continues to make COVID a top priority, working with our health and medical community. We provide guidance, we provide support to our medical providers. We're submitting resource requests to the state. Without being in a state of emergency, they can rely on us for health and medical for things like oxygen needs, any kind of ventilator support, if we need refrigerated trucks, anything like that. And I would just ask that after a year and a half of fighting COVID, that we keep our healthcare professionals in mind. This is exhausting for them. It's taxing for them. They are meeting the challenge, especially with the increased demand for healthcare professionals. So if you have any questions, I'd be happy to take those at this time.
I have one, and
Sure.
I don't mean to put you on the spot. Last time when Mr. Hickey was here, he made mention that masks were not needed, and he wasn't wearing a mask. And so I was wondering what has changed, why you're recommending wearing masks again?
So the CDC guidance is definitely changing over time based on the amount of community transmission that we're seeing. Currently, the entire United States, especially with this Delta variant, is seeing a spike in cases. So being that you can be asymptomatic and spread the virus, not knowing that you might have contracted it, especially since we go back still that 48 hours before your symptomatic date or your test date. So even though I might be feeling well, I might not think that I'm ill or think that I've been exposed, I'm using my mask to protect myself, you guys from me. So the recommendation from the CDC has changed and evolved over time, and I continue to think that they will, take a look at the amount of community transmission they're seeing at a national level, including state to state, and seeing whether or not that recommendation would change.
Any other questions?
Just, I know the medical task force, you had mentioned, Tiffany, about, I just lost my train of thought.
I just was confused, so.
Oh, no.
I'm going to think about it.
Yeah.
Are you going to be here for a while?
I'm
Are
sorry?
you going to be here for a little while?
I
No.
wasn't
Okay.
planning on it, but if you guys have any questions for me,
If
I'd
you
be.
could stay out after the petitions, if anyone's going to speak.
There's no
Well,
petition.
there's no
There's no
petitions. There's no
No
petitions.
tonight.
Okay.
So if it comes to you, then
Yeah, I just have a quick, and I was gonna wait to the end, but I might as well, since you're here, kind of let you hear it. 4 weeks ago, today I tested positive. Tested positive for COVID. Went to our primary health provider, which is the school board clinic. Went to the clinic, she came out and said, "You're positive." My primary provider told me, "Good luck." Told me, "Good luck." And I couldn't go inside, couldn't talk to a PA, couldn't talk to a doctor. 3 hours later, finally got a hold of someone. A PA finally would come to the phone, and she told me, "Well, let's see if it'll run its course." I said, "What do you mean?" She goes, "Well, let's see if it'll run its course." I said, "Well," she goes, asked her, "You're not gonna prescribe me anything?" She goes, "No." She goes, "Well, if you want, alternate between aspirin and Advil." That was their treatment for me, and let's see if it runs its course. I think my health provider failed me. I think they're failing other people in the school board. If they're telling them the same thing they told me, to go home and run its course, like you just mentioned, preventative early treatment, that's the key. Our school board provider is telling us, "Good luck and go home," and and I said, "So if I want something prescribed, I'm gonna have to go somewhere else?" She goes, "Well, if you want something, yes, you are." So of course I had to go to another doctor, and had hydrochloroquine, and probably about the 5th, 6th day, I got really bad. I couldn't get out of bed. It was horrible. I was able to get the Regeneron treatment. The next day I felt better. I had a friend that just got out of the hospital because, let it see if it runs its course. Well, the 12th day into it, he kept getting sicker. Now it's too late. Now you can't get the Regeneron. So I just want to tell you what our health provider is telling our people. And if something happens to them, it's our health provider's fault for telling me, and knowing I was a school board member, "Good luck."
So 4 weeks ago, the monoclonal antibody treatment sites weren't as readily available. Providers weren't providing them as frequently, yet there's still gaps in our area. In fact, the county has been working with the state now to get Highlands to be a state-run monoclonal antibody treatment site for the Regeneron. So, although they are looking at, high risk, if you've had your positive, meaning that you're immune compromised, you have, cardiac, lung disease, you're a smoker, you're obese, which that has even come down as far as the number that you can be considered obese. They do try to prioritize those. I've been told that the state sites, even though they're not run by the local health department, some of them are as big as 300 individuals a day. It does take you some time to get that treatment and run its course and monitor you. But I know they are becoming more providers are coming on board providing the treatment and expanding their chairs that they have. So, to your comment and testament is that, if you do feel like you have, been exposed, you've tested positive, I would say the best thing to do is contact your healthcare provider, but that these treatment sites that are on our website, you can call our call center, you can call the state DOH call center, find out where the closest one to you is locally. And, although they do ask that you make an appointment, I believe they do their best and are successful on fitting you in if you meet that, meet their criteria.
But I would think most competent health providers would tell you at least, "Hey, take zinc, take this." I got a Z-Pack from the other doctor. When this lady told me to take aspirin and run its course, it blew my mind that that's our school board health provider. And I get for the school board members out there, it doesn't cost them anything. They might not be getting their money's worth at that point. But with the school board paying for it, I think we need to look twice to make sure we're providing what is good for our, because if there are the other people out there that went home, I wasn't about to go home and say, "Yeah, okay, let's just see if it runs its course." And then it gets so bad, you get a pneumonia, and then you low oxygen, have many of people. There is a laundry list of people that have died just in the past 2 weeks that I know. We all see it. It's great. This time last year, I didn't know anyone that had it. And just in the last week, I know probably almost a half dozen people that have died. And for our health provider to say, "Good luck and go home and try some aspirin," is just ridiculous.
Yeah, the early treatment with this antibody therapy that basically provides you temporary immunity is the key. It is, becoming more widely available, especially, expanding, beyond those that might be immune compromised. There is criteria. You do have to be 12 and up. So right now, every mitigation strategy, vaccination being the key, is assisting and help building that immunity for those that can't get vaccinated. We have a whole population under the age of 12 that don't have the ability, as we do, to, protect ourselves and our community. The hydrochloroquine hasn't been FDA approved for some time now, and I know remdesivir, the other treatment that is available, is being done within the hospital systems in tandem with the monoclonal antibodies. But there isn't a whole, you're basically treating the symptoms after that as far as, fever, chills, headache. So, vaccination here is the key as a preventative measure.
And I understand, but when you're laying in bed and can't get out, you're willing to try anything. You even take horse, which I'm not saying that. But yeah, you just want a provider to say, hey, I'm going to help you out versus go home and good luck.
Because-
And that's, I
Yeah,
had
Mr.
enough of that.
Brantley sharing that, do you as the health department advise the clinics? Do they reach out to you for advice? Because I'm hearing you say that we should get this treatment if we test positive. So do you recommend that to them? Now, after our medical task force, they are talking about that our clinic will be offering those treatments also. But I agree with Mr. Brantley. Last year, I had people, and it wasn't by any means what we're seeing this year, that some of them went in and received something like prednisone or Z-Pak. Unless they asked for it, they didn't. You're right, they were just sent out the door. But then why would are you advising them maybe of this treatment that they should be advising? Because those people are not able to go in the building, and they're literally driving around in a parking lot, negative or positive, and getting no advice. So that's the thing, is somehow educating what is out there. The other thing, I think at our medical task force, y'all had mentioned that you were gonna, because testing is such a, trial here also, and y'all are maybe gonna get a vendor.
So we are procuring the vendor. The state did fill our missions to get additional temporary for the next 4 weeks, some support, some healthcare professional nurses to be able to provide testing in the health department. We currently are providing the PCR test. That's
Yeah.
the one that you take and you
Just 2
send it
hours
to the
a
lab.
day still?
It depends on where you go. We have, at the health department, we have to send ours down to our lab.
Okay.
So the results, depending on the burden on the labs, can take anywhere to 3 to 5 days. The majority of the testing influx that we're seeing does relate back to the schools and school work, trying to get a reduced quarantine back to school. But the majority of the individuals want that rapid test. So the state is looking at, funding for the health department specific to schools and helping with the testing and that burden, whether we do it in the schools or we refer them back to the health department. They've talked about, delivering them a supply of the Bionex Now, which is the rapid test kits, so that we can work together and address specifically school exposures and, symptomatic individuals that come from the school
Yeah.
system, whether they be teachers or students.
Well, I think Patrick had just mentioned right now the health department, when he spoke at our last meeting, was offering 2 hours a day, where I guess our clinics are trying, both clinics are doing the drive-through, so they're probably 8 hours, but it's taken people 5 hours to get through
To get through the
testing.
line.
So
So us doing the PCR testing, again, a lot of them aren't coming through our line because they
Okay,
want the
'cause it
rapid
takes a little
test,
longer.
but we aren't meeting capacity, meaning we're not turning anybody away.
Okay.
And with these missions that have been filled to support us with the testing and vaccination, it'll allow us, at least over the next 4 weeks, at the health department, which is in addition to us asking for the vendor that will do PCR and rapids, to be able to test the 5 days a week. And we'll start with the morning sessions, and then expand. We have the potential to expand to a full day, a full business day, with that staffing.
You'd mentioned a little earlier about the dashboard that you're working on for us for the schools. Do you
Yes.
have any idea when you might have that ready for those positives?
The state is actually working on it. We don't develop that at the local level. They're working on it as we speak. We were able to pull last week by schools only, and it was for the entire pandemic. So we
Right.
pushed that up as far as, we'd really like to be able to manipulate the data.
Right.
Is there any way we can separate it? Because right now, it's just really what our contact tracer is able to do, which is the numbers I provided today between teachers, staff, students, positives versus exclusions. So I know, they're really looking at being able to extrapolate that data from our contact tracing efforts so that we can report a little bit more accurately, by school
Depict
to the
just what
counties.
we're looking
Yeah,
at.
someone
Okay.
sent me Okeechobee's dashboard, and I don't know if you ever, I've heard that people are really liking that
It is
one.
very
Very,
nicely
very
done.
nice.
It is very very nicely done.
And my understanding is they develop that.
They
this-
did.
Yeah.
Yeah, yeah, yeah.
Would you have a timeline that you think that you would be able to roll out the rapid testing and the PCR testing to a full day or an extended period of time?
So
know
this
that you were
week,
talking
we're
about it.
doing the PCR testing at the health department,
But as far
in
as
the
rapid
mornings right now for the rest of the week, and then we'll start with the 5 days a week. The rapid testing, we're looking to see, those aren't readily available as far as, demand being so high, so we're gonna put in a request from the state, and the state is already sending an unknown at this time allotment down to the school district. So I don't have a definite time frame, but as soon as we have our hands on that or can be assured when we'll get those, we'll be sure to work out a process, whatever that looks like, whatever we decide is the best route to go, if it's a referral process or whatever that looks like.
Because it is very difficult to get these kids back in school.
Yeah.
Anything else, you guys?
I have a question. Is there any possibility for someone who has the antibodies, if they've been told to go home because they were next to someone, is there any possibilities that an antibody test will be available so that they can go and get tested? I mean, that, to me, would be, I don't want to say a natural thing, but would be something that would be a great help.
Are you asking, so if you take an antigen test and it shows that you have antibodies, would that be a reason to
have to
reduce
quarantine?
quarantine? Currently, that is not the guidance that we're following. So the way that you could reduce your quarantine and not have to be excluded, again, we would recommend you wear the mask, is if you are currently vaccinated and asymptomatic, or you've been exposed, contracted the infection within the last 90 days and are asymptomatic. Those are the two criteria that would gain you not to be excluded.
Okay, so do you think at any point will there be an antibody test that would be available for someone to take, as far as maybe not to quarantine, but it's been 5 months?
The health department, you can get an antigen test now.
Okay.
From providers. I would suggest, you call your healthcare provider where you think you can get it from. Some of the urgent cares are doing it. I believe there is a fee. That's not one of like the testing that, it's free to you, and maybe they would charge your insurance. The health department, it's not their mission at this time to do antibody testing.
And at this time, you'd still have to quarantine.
Right,
Yes.
right, if it's after 90 days.
That's what I was saying, we're just
Yeah.
not using it.
Yes, but
I think, does Walgreens do the antibody test? I don't know why.
I don't know. I know Heartland Pharmacy does down in Lake
Oh,
Placid.
okay,
I know,
okay,
I
that's
saw a
probably it.
sign up there. That's the only reason I know that, kind of brought my attention to it.
Anything else for Tiffany?
Appreciate
Thank
your
you so much
time.
for being
You're
here
welcome.
tonight.
Thank you so much.
you. Andrew Lethbridge is going to come up and give us a little update from our school system and how we're going to try to move forward with some of this.
I wasn't planning on going here, but let me update a little bit on the clinic. Ms. Brantley, I ended up hearing about your experience through Dr. Longshore and a few others that had similar message. So I did reach out to the clinic, and Ms. Mortensen and I met with them last week and did share that our employees, that the message can't be good luck or that's it. They are working on a flyer specifically that says different things that individuals can do. Up until some of the most recent treatments, there were limited things that they could provide. But as far as advice, next steps, if things get worse, what should you do next? There's no reason that we shouldn't be able to hand that out to employees, just so that they at least know what to look for and then know what to do next if that's needed. So they're working on that. They were extremely apologetic when we met with them. But we just said that's not acceptable. So they were working on that, and I'm not making excuses for them. They are facing staffing issues and people sick, just like everyone else. And at some point, even recently, they had more than half of their staff out with COVID themselves because they were having issues there themselves with it, which doesn't excuse, the answer that you ended up getting. But there are a lot of challenges going around, so hopefully we'll have that in place. I've not seen the flyer yet, but we've requested to review it once it's done. just so that other answers are going out. And I know that as far as the antibody treatment and different things like that, that they are suggesting that to patients at this point, because I've just been checking with different people that I know that have been positive, that what is the message, what is being shared with you, as I've had conversations just to make sure that the messaging is getting better on that side. So I'll continue to check on that as well. As far as the dashboard, tomorrow we should be able to have a quarantine dashboard that is up and running, very similar to Okeechobee's. We are still working on the positive cases one, and just some of it is really the data, making sure that all the data that we have is complete and that we're accurately demonstrating that data. So we're hammering out that, but we still may be a week off from the positive. But tomorrow we should be live, and it's interactive, and it's by school. That would show all of the quarantines, and we're very solid with how that looks and in the interactive that it's giving good data on that side. So I just wanted to update you on that. I know that I've had a lot of inquiries on that part, so we are working on it. In the past, we were using the states, and honestly, up until school started, we thought the state was still going to have theirs, and then they weren't updating it. And many of us were hoping that COVID was waning and different things, and then it hit hard. So it's not that I'm casting shade on them, but up until that point, we were anticipating using that, and then we've, at that point, started developing our own, and so that is where we are on that project, so.
Thank you, Mr. Any questions for Andrew?
I don't have a question, but I would like to just throw this out, and it's not in defense of the clinic, it's just to throw it out. I have been told by several nurses, different of both hospitals that we have here, that exactly what you were told, Mr. Brantley, that it's a virus and it just has to work its time. So but maybe people are realizing that's not the best answer.
I'm not gonna sit there and wait for it to get
No,
here like it's
no,
gotten
you can't,
so
because-
many other people in the past week.
Yeah, I'm not saying I think it's the right answer, but I have been told that by other providers also, just throwing that out there. Like I said, I don't think it's right, and I didn't settle for that when my family got it,
Sure.
but I'm just
Yep.
throwing that out there.
Well, thank you for addressing it.
Yes.
And also for working on that dashboard.
Yep.
I know that's a
Yep.
moving target and a little challenging to do, so thank you for getting that in order as well.
Thank you.
Well, we're going to change gears a little bit. Mr. Tim Thompson is going to give us some information. His department has gone through many, many changes in the past recent weeks and months, and so I just wanted him to bring the board up to speed on some of the things that he's facing in his department.
Good afternoon, good evening, good evening. I know that some of us spoke kind of in between the workshop, maybe, about some of the trials that we were having. The biggest problem that we're having is that US Foods vacated the contract. They attempted to vacate the contract for just about every K-12 food service program in the country. They were more or less successful, depending upon where you are. Hillsborough fought back and Miami-Dade fought back. But right now, they're going to vacate our contract as of December 31st. So our previous lead agency for Power Buy was Osceola County, and they decided they no longer wanted to handle it. And so Citrus County is the lead agency, and they streeted a bid. The bid opening is September 23rd, which is kind of short time for us to get our food in place. The fallout from it has largely been that the market is kind of weird right now as far as food. Restaurants are booming, and it's made it difficult for us to get some of our food. However, I believe the last time I spoke on the subject, we were probably seeing somewhere between 400 and 500 cases a week being shorted off our deliveries. And I want to say that last week the shortages were minimal. Some of that has to do with that we're reacting to what foodstuffs are in short supply in the market, and we're identifying other products. And some of it just has to do with they hired a significant number for them of new selectors for people who load the trucks. And so that's made a huge difference in their capacity. They usually we get delivered out of Port Orange, and they move about 100,000 cases a night out of that warehouse 5 nights a week. And they were down to where they were only being able to select about 75,000 cases a night. So they were getting hit real hard with just being able to get trucks on the road. And that's about where we're at on US Foods in our contract. Do you guys have questions?
If we don't do US Foods, who's the other major providers that would service?
So in the state of Florida, you have Gordon Food Service, you have PFG Reinhardt, which I don't think that they have very few distribution houses in the state of Florida. And you have Cisco is another big player. They have a distribution center in Southwest Florida and then on the East Coast, like in Palm Beach. But Cisco has spent a significant amount of time trying to get out of the K-12 business. However, there are some people who we have been talking to strongly. Their vice president of K-12 development has engaged Power Buy. Like, we can't talk to them now because we have a bid on the street, but they had asked us some questions, and we provided some information to anybody who would talk to us about how many districts it is. It's currently it's 29 districts in the state of Florida, so roughly half. And so, but it's basically those three. I do know that there was a K-12 provider, about 90% of their business is K-12 out of California. I just don't see how they can stand up distribution for 29 counties in 90 days. They don't have warehousing or employees or anything in our areas.
Well, thank you, Tim, for
Absolutely.
being so diligent through this challenge. You've been with this particular company for how many years, did you say? That
I think it's been more than 20 years.
more than 20 years, so.
I think that we've been with US Food has had our contract since probably 98 or 99 with Power Buy.
Yeah, so, thank you very much
Yes, ma'am.
for holding it together,
Well,
keeping our kids
Time will
fed.
tell.
Thank you. The last thing is just permission to revise 7A Highlands County 21-22 K-12 Uniform Assessment Calendar. And we'll be adding PSAT/NMSQT in grades 10 through 11. PSAT/NMSQT in grades 10 through 11. And that completes my announcements. Thank you.
Quick question, did you say M as in Mary, or
N as in Nancy.
Okay,
M as in Mary.
okay.
Thank you.
SQT?
Yes, ma'am.
Okay, thank you. Thank you. We'll move back to a motion to, oh, I see it, it's right here, though. Adopt the agenda.
Move approval.
Second.
Thank you. We have a motion by Ms. Howerton and a second by Mr. Durrance. Is there any public comment? Come back to the board, any comment? We'll do a roll call. Ms. Howerton?
Yes.
Mr. Durrance?
Yes.
Ms. Compton Twist?
Yes.
Mr. Brantley?
Yes.
And the chair votes yes. Back to consent agenda. Thank you. A motion to approve, thank you. I knew it was on there somewhere. Yet the motion to approve consent agenda items as revised.
Motion approved.
Second.
Thank you. We have a motion by Mr. Brantley and then a second by Mr. Durrance. Is there any public comment? Back to the board. Comment? We will do roll call. Mr. Brantley?
Yes.
Mr. Durrance?
Yes.
Ms. Compton Twist?
Yes.
Ms. Howerton?
Yes.
And the chair votes yes. We have 10A, consider approval of superintendent's recommendation for personnel.
Move approval.
Second.
Thank you. We have a motion by Ms. Howerton, and a second by Mr. Brantley. Is there any public comment? Back to the board. Any comment? We'll do roll call. Ms. Howerton?
Yes.
Mr. Brantley?
Yes.
Ms. Compton Twist?
Yes.
Mr. Durrance?
Yes.
And the chair votes yes. 10B, consider approval of adoption EKG, optional EKG for athletics beginning with the winter sports season.
Motion to approve.
Second.
Thank you. We have a motion by Mr. Durrance and a second by Ms. Howerton. Is there any public comment? Back to the board. Any comment?
Mr. Leesburg had called us on this, I
Yes.
appreciate that.
You want to say
Yeah.
something, or you good? I guess, okay.
Any board comment? We'll do roll call. Mr. Durance,
Yes.
Ms. Howerton,
Yes.
Mr. Brantley,
Yes.
Ms. Compton Twist,
Yes.
and the chair votes yes. 10C, consider approval of expulsions.
Make a motion to approve?
Second?
Thank you. I have a motion by Ms. Compton Twist and a second by Mr. Brantley. Is there any board comment? No? Roll call. Ms. Compton Twist,
Yes.
Mr. Brantley,
Yes.
Ms. Howerton,
Yes.
Mr. Durance.
Yes.
And the chair votes yes. 13A, consider approval of adoption of mechanic appearance job description. Yeah.
Motion to approve.
Second.
Thank you. We have a motion by Mr. Durance and a second by Ms. Howerton. Is there any public comment?
Do you need to do proofs?
You don't need public comment for the expulsions?
No, sir. No, this is for the mechanical.
Yes, ma'am.
Okay.
We published it.
Okay. Is there any board comment with that? So it is, everything's published, so we're all good with that. Okay, thank you. Roll call, Mr. Durance?
Yes.
Ms. Howerton?
Yes.
Ms. Compton Twist?
Yes.
Mr. Brantley?
Yes.
And the chair votes yes. 13B, consider approval adoption of the revision of the code of the student conduct for 2021 through 2022 school year.
Move approval.
A second.
Thank you. We have a motion by Ms. Howerton and a second by Mr. Durance. Is there any public comment? Back to the board. Yes, and I just want to say, I know that there are several organizations that work together to make this all happen, so I just want to say thank you to all the ones who do work on this. Is there any other board comment? You'll do
I
a
did
roll.
have one question. I'm so
Yes,
sorry.
ma'am.
I did
No.
have one question under the, and I don't see her here, but under the Highlands Virtual School, I saw that there was just one little section in there where it said that we could make changes at any time without prior notice. And I just thought that was,
Under which section?
Changes with them going back to the brick and mortar school, is that?
I'll pull it up. I'm sorry, I meant to ask you that before and I just remembered that. It's right here. So, it would be, this one right here, added paragraph 2 and 3 on section 12.
What page are you on?
It's the parent guide pages with changes, so under the Highlands Virtual School, number 12, added paragraph 2 and 3.
Well, it may be deer in headlights, but that's under the code of student conduct?
Yes, sir.
Paragraph.
13B.
What page is that on? Does it say?
It's under the parent guide pages. So page,
Dr. Campbell,
I'm
do
sorry, I'm
you
looking
have
at
that
about 60
information?
pages.
In regard to Highlands Virtual School, paragraph 2 and 3 in section 12 of the parent guide?
it's page 12 of the parent
Page
guide.
12.
You need to bring that up.
It's page 12 of the parent guide,
I don't have that here either.
paragraph 2 and 3.
Maybe she could, maybe Jill could read it.
He's got
Ms.
it
Compton.
right here.
Yeah, Jill, do you have that there?
I'm not sure this is the parent guide, though.
You said page 12?
Of the parent guide.
Of the parent guide, not the code.
Oh, okay.
Hold on, I'll pull it up and read it to you. Yes, ma'am. I'll read it in just one moment.
Paragraph 2 and 3, I think, is what was on here.
says right here, on paragraph 3, it says, "The principal reserves the right to determine appropriate consequences to be imposed upon a student for any infraction of the code of conduct, including misconduct not specifically listed. HVS reserves the right to amend the content in this handbook at any time throughout the school year without notice."
Yeah, so the without notice shouldn't be there.
Okay.
That part. So what I do know in conversation is that there are several, since our virtual school is new and robust, there are several instances of behavior that they may not have
Sure,
experienced
and
just
I
yet.
understand
So
that.
I think she was just looking for a way, but the without notice part,
Correct.
we would have to find language that would give them the opportunity to still move forward with
Yes, ma'am.
disciplinary responses for students that might not be listed. So we just may have to find we'll find a better way to express
Yes, ma'am.
something like may not be listed or something along those lines.
I was just concerned of the
Absolutely.
without
Sure.
notice.
I agree.
Brought that up.
I
Good
agree.
catch.
So we'll work to find the language specifically for that.
Thank you.
You could either do it except for the parent guide, or you could simply delete the words without notice and approve it in that fashion. I realize that we're potentially looking for a rewording of that entire paragraph, but at least for tonight, would you agree that we'd be okay? Yeah. So delete the words without notice. No.
Okay.
That would be an amendment that's being offered. There's been a motion yet?
Yes, sir, we have a motion by Ms. Howerton
And
and a second by
I'd be good with
Mr.
that
Durant.
included in my motion.
Okay,
And I'll change my
okay,
second.
okay.
I think she amended and amended.
Amend the amendment.
I'm keeping you up.
We will come back. Is there any public comment with the revised? Nope. Any board comments? And thank you, Ms. Compton-Twist, for
thank you.
catching that. Appreciate that. Anyone else? Okay, we will do a roll call. Ms. Howerton?
Yes.
Mr. Durant?
Yes.
Ms. Compton-Twist?
Yes.
Mr. Brantley?
Yes.
And the chair votes yes. 13C, consider approval of the adoption of the revisions to school board law, bylaw 0165.1 agendas.
Move approval.
Second?
This has also been published.
Okay. Can we do that? Okay, we have a motion by Ms. Howerton and a second by Mr. Brantley. Is there any public comment with that? Back to the board? No, okay, we will do roll call. Ms. Howerton?
Yes.
Mr. Brantley?
Yes.
Ms. Compton-Twist?
Yes.
Mr. Durant?
Yes.
And the chair votes yes. 14A, review and discuss previously denied out-of-school, out-of-zone transfers until pursuit of the School Board of Highlands County Student Agreement Enrollment and Choice Plan Agenda item.
Yeah, it's on the, this is in your,
Okay, if you could please state your name and the student's name.
Alicia,
And are we going to mute the
which name was this?
face? Yes, sir?
I think we'd be much better off to simply advise the presenter of the issues.
That,
so-
okay.
So let's do it that way.
Okay.
I'm sorry,
Then-
what was the
So-
student name on this?
James Mays.
Okay.
Correct.
Just please be aware that this is a Facebook Live meeting
Yes, ma'am.
as far as content with your child and
Oh, yes,
anything you
ma'am.
don't want,
I appreciate it.
okay.
Thank
We
you.
just want to protect our students as much as possible.
Yes, ma'am. Thank you.
Go ahead.
Go ahead, please.
My name is Alicia Capers. I'm James Mays' mother. James is currently a student at Heartland Christian Academy. Amazing school. I literally 20 thumbs up if I can. The only issue is my son is autistic. We just moved to the district last year from Pennsylvania. And in regards with us moving, James was last year virtually. So he's normally zoned through Sebring High School, but by him being virtual, them not having ESE classrooms virtually, James was through, his homeroom teacher was Ms. Hearn. So this year, when we went to transition James back into in-person, I wanted to put him in private school. This is James's senior year. He wants to, pursue a business. So I wanted to look for a private school, something that could help me definitely gear my son towards that. Highlands is there for that, but unfortunately, the accommodations for James isn't there. They don't have like an ESE classroom. Right now, with James being a senior, because of, certain things we have to, work with James with his math. James is starting to fall out of place because because there's no parapro in his classroom or someone to help him reinforce what's going on. He has to be now in a classroom like with sixth graders. So it's getting to the point like with my son being autistic in the mornings, he's asking me like, Mom, they don't listen to me, and I don't think it's necessarily the school's not listening to him. It's just unfortunately they can't go, forward with helping him with more one-on-one. And I've even spoke with the guidance counselor, even with the administration, and we all even agree because it's more of an advanced school gearing the kids towards college. Not saying that that's not what James is geared for, but right now half the students are like almost graduating, college and high school. So with that being said, James, he wants to go back with Ms. Hearn, Ms. Harris, Ms. Daly, his other peers that he's seen virtually, who he personally has their cell phone numbers, personally still even keeps in contact with his classmates over the summer. I tried to get him in there, but unfortunately, I guess I was declined because it might be the spacing. Because like I said, again, James is supposed to be zoned to Sebring High School, but then by us coming in virtually, James knowing everybody through Avon Park is not one person in Sebring, to my understanding. But James just wants to head back there. He wants to spend his senior year and the rest of his, couple years that he does have to gear in public school to do it more in Avon Park, especially with the accommodations, because last year there was nothing like this,
So he's zoned for Sebring, but you want him to go to Avon Park?
Correct.
I will make that motion.
Second. And that is after kind of talking to Heather and I think there's 3 classes at Avon Park High, there's 2 at Sebring. So I think when you really kind of look at the numbers, I know there's more at Avon Park, but I think there's more teachers. Isn't that correct, Mrs. Lanier? So I just want to say.
I just want to make sure that you understand how ESE classrooms work. And I know that you
I do.
understand
That was
this
the
as
only
well.
It's not all the numbers,
And that's
it's
not all the
severity
numbers.
and
And
some
they're
different
they're
things, yeah.
differentiated by, like you said, severity and how the classrooms are made up. So just because you have 4 in a classroom or 6 in a classroom doesn't make it
Exactly.
Doesn't make it equal, yeah.
it evened out or lessened.
Right,
I think that they base them upon the well-being of the student and how much that each particular student needs educationally and physically or mentally, or however that's the best for every student in that classroom. And we're trying to do what's best for each and every student.
And the
So
kid-
it is a very hard call. It's not just,
No,
we
no,
have
yeah. And I had
29
asked some of
here
the
and
particulars
41
like you're
there.
asking when I was speaking to
Yes.
that individual.
I did as well,
So-
and I have an ESE background.
Yeah, Ms. Lanier's here.
And it could affect an individual having to move
Absolutely.
schools by this move too, just something to think about,
Well, and the only he was at Avon Park High,
No,
wasn't
he was at Sebring High School, is his
No,
zone
I think
school.
before he went to the private school,
No.
was he at Avon Park High?
It's weird because, like I said, Sebring at the time when we moved to the district didn't have it virtually with the ESE students. So I guess his homeroom teacher, who was Miss Cynthia Hearn, she's zoned through Avon Park. So
Yeah,
this
I
whole
guess that's
time I've
where
been, I honestly know everybody at Avon. Honestly, the only time I went to Sebring was just to pick up his laptop and to drop it off. But everybody that I personally know in contact with James has been through Avon Park.
See, that's what I thought, that she was dealing with people from Avon Park too.
Ms.
picked
Lear,
up
would
his
you
things
like
from
to, do
Sebring.
you have anything to add, or? And just please state your name and occupation.
I'm Pam Lanier, the Director of ESE.
Thank you.
So you had questions about actually how that service was provided last year. So what we did was our high schools partnered together, and Sebring, Avon Park High School provided a teacher for our students that are on access points that needed to have a virtual instruction. And so that's why it seems like that they're from Avon, that they went to Avon Park High. It's because they partnered and that teacher came out of Avon Park High in order to provide that access curriculum. So some of the students at Sebring High School that were on virtual went back to Sebring High School. Some of them that were at Avon Park High went back to Avon Park High. And so when we're considering the numbers right now in those, you're right that there is another teacher over there, because you can't let the classes get too big, and you've got to send in that support if the numbers are getting too high. And so we're watching that carefully at Avon Park High, because when you think of the size of the school of Avon Park High and the size of the school at Sebring High and what the proportionate of students with disabilities inside, we're just trying to be very careful with that. And so that's where we are at this point.
Do you
Because
foresee a
it's-
problem with this child going to Avon Park as far as capacity?
So it's not that I see a problem with this child going towards it. I've had to be very careful because people, it's like when you have a pre-K at a school and people get used to students being in that pre-K and then they want to stay at that school, then we become out of proportion for our services to the students with disabilities. So when we did this virtual, we had to come up with a plan for students with disabilities that were on access points that needed virtual instruction last year. And so doing this, it does create, I know these people, and so I'd like to stay there. But remember, some of our students can stay in there till they're 22. So I'm trying to watch all those numbers. So do I say no that, do I have a problem with this particular? No, but with all the McKays that come in, I have to watch, all of them. So ultimately, at this point, it's up to you all, but that's where how I made that decision, talking to the principals and what the numbers are. And remember, it's not all just about the ESE classroom. It's also about the speech and language therapy and the occupational therapy and the physical therapy at the schools. So all of it plays a role, but no, I wouldn't say that I have a problem with one particular student going, but I get more than one McKay too, so I have to do it fairly. Does that answer your question?
Would this student have to apply again next year?
He's a senior, so he may graduate this year.
That's right, I think that is what I recall too, is that he was a senior. So I was just trying to, this last year. Yeah, so that was another thing that was brought to my attention, was he was a senior, and I was just hoping to
Work out for him.
for him.
Thank you, Ms. Lanier. Okay, right now, as it stands, we have a motion by Mr. Brantley and a second by Ms. Howerton. We had some comment, and is there any further board comment? Anyone? Okay, so I will call on the motion. Mr. Brantley?
Yes.
Ms. Howerton?
Yes.
Ms. Compton Twist?
No.
Mr. Durance?
No.
And the chair will vote yes. So you can pull out his senior year.
Thank you.
Thank you. Best of luck.
You all as well.
Was that the only one we had? Oh, okay, okay. 14B, consider approval of out-of-state travel for Lake Placid High School FFA to Moultrie, Georgia, October 19th through the 21st, 2021.
Move approval.
Second.
Thank you. We have a motion by Ms. Howerton and a second by Mr. Brantley. Is there further public comment? Is there anyone from the Lake Placid FFA that would like to talk? I mean, it's, yeah, we.
Tell us a little bit
Yeah, a
about-
little bit about what they're doing and. after all, you came here and you've been sitting here all this time.
I just want to make sure somebody was here. My name's Kelly Prescott, and I am the advisor at Lake Placid High School. Thank you for a second of your time. This year, we chose to go to the Sun Belt Expo in Moultrie, Georgia, where there are industry gurus everywhere, and it's one of the most amazing outdoor experiences where I'm taking 5 of our officers, all girls. So I love that they're going to be able to get to see the Southeast best industries, from technology to aquaponics, things that we might not have here in our county. We're not going to try national convention for a couple of years. We don't really have any reason to go to national convention yet. So we're choosing to go somewhere where they're going to get tons and tons of information for 2.5 days. We're going to travel up there. We're staying in Valdosta. It's very hard to find somewhere to stay in Moultrie at this point. So we're going to be staying in Valdosta, traveling to Moultrie, and then we're going to stop off in Tifton to do a couple of little college tours, tour the Georgia Museum of Agriculture, and then work our way back down. The girls will go to school on Monday. We're going to be gone Tuesday, Wednesday, Thursday, and they'll be back in school on Friday with lots and lots of information, and we're super excited about it. There's 3 days just of everything, and honestly, I'm going to let them just have their time to pick and choose. We have a girl who's an amazing horse equine. She needs to go to that one, and we're just going to divide and conquer and allow them to just really delve into what does the Southeast have. We want to keep them here in our county, and I'm just being a little selfish about that. I'd like for them to come back into our county, whether it's to teach or starting aquaponics, because agriculture, and I'm not going to preach because I do love ag, but agriculture is so huge in our county, and we need to see what's out there other than our small area, because we can talk about cattle, citrus, sugar, we can talk about a few more things like that, but it's going to be so neat to see them come back and bring it back to our ag program. And they want to come, and I actually talked to the girls today, and I've never had an all-girl officer team, so that's always going to be fun. But we're super excited, and they would like to come back and share with you in December and explain to you what they did, what they learned, and how they're bringing it back to our area, because I do believe that if we can get that out and bring it back to our county, we have so much better opportunities, not just for the girls, but it's going to be really neat for them to go and see and do and experience the best of the industry. Any questions I could answer?
I've heard this is really a neat experience, and many from Highlands County go year after year after year.
Yes, ma'am.
so.
And lots of vendors actually from
Yes.
our county actually go there. The college opportunities there, and when I say the whole Southeast, the college opportunities are there. But, we also have to go career tech. We need to start putting some CTE in and letting them see that career tech and understand that, there are so many opportunities. And although South Florida does an amazing job of that, letting them experience it and come back. And I do expect them to come back and divvy up their time and share everything they've learned with our chapter, with our ag kids, with our school, and anybody else that'll listen to them.
Will they be able to network with other FFA students that are there, do you know? Do you know
Yes,
any other
ma'am. We are
counties?
actually going to meet up with some of
good.
them. So, yes, ma'am. And it's
And
not
kind of get
necessarily
some
just an.
ideas of what they're doing.
Yes, ma'am. It's not just FFA. It is also just the entire ag world coming into one small town for
But like you
3
said, bringing
days.
some ideals back to our
Yes,
schools,
ma'am.
yes.
Yes,
Thank you.
ma'am.
Well, and we would love to have them come back and share their experience with us.
Yes, ma'am. I think that would be amazing if they could do that. And they asked today, like, could we do that? And I said, I think that would be a great idea. So Ms. Marlene and I had that conversation earlier
Perfect.
today.
Very good.
Is there anything else I can answer for you guys?
Thank you.
No, ma'am, thank you so much
Thank
for
you.
coming. Appreciate you
Yes,
being
ma'am.
here.
We appreciate you very much.
Any board comment? No? Okay, back for the roll call. Ms. Howerton?
Yes.
Mr. Brantley?
Yes.
Ms. Compton Twist?
Yes.
Mr. Durns?
Yes,
Sorry.
yes.
And the chair votes yes. (15A), consider approval of 2021 annual financial report.
Move approval.
Second.
Thank you. We have a motion by Ms. Howerton and a second by Mr. Durance. Is there any public comment with that? Do you have anything you need to share, Mike, that's earth-shattering?
I'd like to publicly thank Angelica and Stephanie for putting this together. There's been so many changes in GASB law. It's a very complicated document to put together. I just want to give them credit.
Thank you. I'm sure they appreciate that.
Worst accounting year ever, right, Mike? For everybody.
Any public or board comment? No? We'll do roll call. Ms. Howerton?
Yes.
Mr. Durance?
Yes.
Ms. Compton Twist?
Yes.
Mr. Brantley?
Yes.
And the chair votes yes. 15B, consider approval to award contract to new vehicles to Bill Jarrett Ford, SBHC 2122-04.
Motion to approve.
Second.
Thank you. We have a motion by Mr. Durance and a second by Ms. Howerton. Is there any public comment? Back to the board for comment? No?
Appreciate it being local.
Yes, yeah, I try to preach that as much as possible myself. We will do a roll call. Mr. Durance?
Yes.
Ms. Howerton?
Yes.
Mr. Brantley?
Yes.
Ms. Compton Twist?
Yes.
And the chair votes yes. There are no emergency items, no legislative issues, planning and zoning, HCEA. Any HCESPA? Any comments? You're good? Okay. School board attorney reports, comments?
I would just simply report that with respect to the ongoing COVID masking issues and things like that, as you all read in the paper, Hernando just joined, and so I think the count is, what, 14 now, I think? Probably what you don't know is I also just received a petition of Miami-Dade County, not in the court system, but rather through the Department of Administrative Hearings, challenging the rule adopted by the Department of Health regarding this matter. Basically going through an awful lot of detail regarding their concerns about the statements made in adopting the rule and validating those statements, saying they weren't well thought out and whatever. I don't say that I have any comment pro or con on that. I'm just simply reporting to you that it continues. And I don't know what the ultimate outcome is going to be. You've all read in the paper too about the initial hearing. There were a lot of people that felt that while he announced his findings on the record, that there would be more detail in the actual written report, but there really wasn't. So, you know, it kind of can go both ways in terms of how the appeal might be from that type of decision. So it's all up in the air. I fully expect it won't be resolved until it gets to very likely the Supreme Court, and I think it'll get there fairly quickly. And they'll get it resolved, and they will know a little better what the rules are, what we're supposed to do, where we go. You know, I don't think anything's going to change majorly. I really don't for what you're doing. This is a lot of local decision-making based on what's happening in your county, based on your accountability as a school board. And I really think that's where it ought to be. You know, it's your responsibility as elected officials to determine how your school system is going to be run. And so I think that's sort of where things are. You know, the state's done a lot of very positive things, I think, for this district and many others with respect to allowing local control of how we're going to do things, keeping people paid, keeping people employed, keeping things going, waiving rules that would otherwise have crippled the school system during this COVID period. So on the one hand, there's a lot of positive going. On the other hand, some people feel that politics are getting involved in decision-making. So, you know, the fat lady hasn't sung yet. That's all I can tell you. And so I'll leave it at that. That's all I have. Thank you.
Thank you. Ms. Howerton?
Well, Mr. McClure, I'm gonna put you on the spot.
Okay, again?
Again, because, I mean, prior to the meeting, and then some people that were here at our meeting tonight are pushing us to have a workshop, which I do feel that we do have some things as a local control, but then on some other things that they're wanting to address in a workshop, I don't know that we're gonna have local control there. So my question to you is, I guess it was kind of like I heard Mr. Brantley say, is, I mean, if we pit one parent against the other parent, are we looking at a liability as a board in making certain decisions? Do you feel it's worth our while? Because I've got someone from DOE saying, we can't cut funding, so, okay, so, you know, so who is cutting the funding, and do we want to get in that battle, you know?
Well, again, I
As a-
would have
as
an
our
opinion,
attorney.
not that my opinion is any better than your opinion or anybody
No, I
else's on
respect
such
your-
matters as
your
this.
attorney.
But the bottom line is, in my brief conversation, there was a feeling on their part, there was discrimination, for example, if we send home those who are not vaccinated, but we allow those who are vaccinated to stay in school. The answer to that, in my opinion, is it discriminatory? Potentially. Is some discrimination nonetheless supported by the law? I think, again, potentially. You know, I mean, if there are good reasons for discriminating, and we can only go by CDC guidance, we can only go by other things. Yes, there are some who appear who say, that's voodoo, don't believe them, let me bring my experts in and I'll show you what the real case is.
They want us to address contact tracing, and I don't know as a board member that I want to.
That's impossible to get involved in that.
That's what I needed to have you say.
Well, I'll say that, okay? The other thing is, so much of it was well addressed, in my opinion, in a line by Paul Simon when he wrote The Boxer. And it's still, a man hears what he wants to hear and disregards the rest. I mean, it simply is that. There are many people who have strong opinions on one side, and on the other side, they don't really want to meet in the middle. It's my way or your way, my way or the highway. I can't change it. I will say this, some of the folks here tonight had, I think, a very concerning, valid point, and here's what it is. Look, when you send all these kids home, you are totally disrupting the world as we know it. Because, you know, I've got to work, she's got to work, we got to be here, we got to be there. What are we supposed to do with these kids now? They come to school, they're not sick, you're sending home healthy kids, and what are we supposed to do? You know, ma'am?
And they're not learning.
No, that's right, not learning. That's it. Well, and all that is true. I really can't disagree with the fact that it's true, but still the question is, what is the greater public good? And what are you to do as running a school system? Because it is very clear that the Delta variant in particular, of the COVID-19 virus, is quite contagious. It is running through our school system now. This isn't maybe what could happen, this is what is happening, okay? And so some responsible actions have to be taken to deal with this. I don't know any better way to say it.
No,
You
I
know,
agree. Yeah, I mean, they've just got to understand we're doing what we can do to keep our doors open and keep
Well,
teachers
you
in,
know,
you know, so.
that you're not gonna make everybody
No.
happier, I'm sorry. It's just not gonna happen. These issues are all out there, these problems are there, they exist. You're not gonna change them, I can't change them. The reality is, you know, can you equate this virus to the flu virus like some people want to do? Say it has to run its course, so we don't send people on for that, why are we sending people on for this? Why this, why that, why the other? You know, and if you can figure out a great way to respond to that, okay, let's go that way. I don't have any great responses, bottom line. But I will say, the flu virus on occasion does kill some people that are in certain conditions. This one seems to be a little more dangerous, a little more deadly to me than the flu virus. I think we certainly have one board member that would quickly agree with us, I'm sure. So I don't think it's fair to make those comparisons. There's just a lot of things that aren't right. You will not get anywhere, in my opinion, by having a big workshop on this. You'll not get anywhere by them bringing their experts in to talk about their side. CDC on the defense, bringing in your people, what do we do? What's the science? It's voodoo science, it's great science. You know, you're just not gonna get anywhere with that. So that's the best I can answer you, ma'am.
I wanted my attorney to know.
Best decision we can make at that time is what we feel like we've done. And that's all we can do.
Thank you.
Anything else, Ms. Howerton? You're good? Okay. Mr. Brantley?
I'll be brief since we're still on the COVID topic. I think I bashed the urgent care enough. The conclusion of the story was, for 3 days, and I'm not going to tell anyone to get vaccinated, not to get vaccinated, that's obviously their choice. I was completely against getting vaccinated. It was 3 days, I had 3 days of hell, and I thought I was going to die, and at a point I wanted to. It's bad. It's something that you can't describe to people. It's different things, you know, to everyone. As far as some people can't breathe, some people it goes to chest, some people does all kinds of things. But for 3 days, you can't sleep because you're in so much pain. So you pass out for 30 minutes here or there, and then you wake back up, and you pass out again. Sorry, emotional about it, but it was in the last week. I can tell you 5 people that died. It's one of those things. I'm against the vaccination. If I knew what I know now, I would have got vaccinated. In 6 months, I guarantee I'll get vaccinated. It's just, until you go through it, you don't know how bad it is. It's rough.
Thank you, Mr. Brantley. And we were all praying for you during that time. Ms. Compton Twist.
I want to thank everybody who's here tonight. We appreciate having meetings and have people show up for them. Even though we didn't have a lot of comments tonight, we still appreciate that you're here. We appreciate that you take the time out of your schedules and participate. We welcome you back every time, and we appreciate comments from you and comments from the rest of the board. We might not all agree, but we're all here for the greater good of the students.
Is that it?
That's it.
Okay. I didn't want to cut you off.
No.
Mr. Durns?
I want
Not
to
here to argue.
give kudos to one of our members, I believe, Mr. Brantley. Very humble. He does a lot for this community, and I did want to just give him a shout out for being Man of the Year for Highlands County for the Highlands Nissan. So
My wife still doesn't
congratulations.
believe it, though. I try to tell her every day. She just doesn't believe it.
You've got to keep you humble.
Yeah, I got the plaque.
That was fake.
I just also would like to thank everyone who showed up tonight. I always encourage everyone to come and fill out the petition form. So, I mean, you're here for a reason. So if you come to another meeting, we encourage you to fill out the petition form and let us know your view. And then I also would like to just let the Ogg family know and all the families in our community who have lost loved ones. It's nothing you can really say. It's just very, very sad, and our thoughts and prayers are with all of you. And at that point, we will call this meeting adjourned.